Hey guys, this video is to create awareness in general public. At this point of time, healthcare system has crashed in major cities and you may not get medical assistance in time. You have to be a doctor by yourself until you find a doctor. In this video, I'm going to explain standard medical recommendation in layman terms for public education. Do support the cause to increase health literacy in common people. Timely oxygen can save lives. If the oxygen level in your blood is below normal, that's hypoxemia. The symptoms are shortness of breath or difficulty in breathing. That may lead to hypoxic injuries to your internal organs such as heart, lungs, and so on. Hypoxic injuries are the major effects of COVID-19. Hypoxemia can be determined by measuring SpO2, that is oxygen saturation level in your blood using pulse oximeter. SpO2 in pulse oximeter normally ranges from 95 to 100. Anything below 95 is considered low, anything below 90 is considered critical. We all know that more people have chances of getting coronavirus. Few may end with less symptoms and few may end with severe symptoms. This is mainly due to age factor, panic attack, and pre-existing health issues. Patients may end up having no bed or admission in hospital, and hospitals may run out of oxygen cylinders. That's what is happening now. In this case, doctor may test SpO2 in patients, and if it's more than 95, doctor may prescribe some vitamin and advise home treatment. Doctors usually prescribe zinc vitamin, vitamin D, vitamin C, omega-3 fatty acids, and calcium tablets. All these vitamins are available for children in syrup base. As a precaution, you can start these supplements right away and continue for 3 months. So, what if a home treating patient's SpO2 level drops below 90 or have shortness of breath? Follow the simple trick while you arrange for oxygen cylinder or waiting for an admission in hospital. First thing first, try the prone position. Visit your nearby pharmacy and buy these list of medications. 1. Nebulizer. Buy a good quality nebulizer. 2. Respules. Respules are carrier to nebulizer, also called as bronchodilators, that helps reduce mucus, chest congestion, and helps us breathe. There are tons of respules available in the market, and the safest ones are Budocort and Duolin. Budocort can be used maximum 5 to 6 times a day, and Duolin can be used maximum 2 times a day. 3. Methylprednisolone. Methylprednisolone is an anti-inflammatory and immunosuppressive agent that has been proved to prevent progression from severe to critical respiratory infections. Methylprednisolone dosage depends upon the SpO2 and CRP test. For example, if SpO2 is below 93, you can start with 16 mg 2 times a day for 3 days and gradually reduce the dose. That is 8 mg 2 times a day, 4 mg 2 times a day, and 2 mg 2 times a day. 4. Doxycycline. Doxycycline is an antibiotic. Since methylprednisolone is an immunosuppressive, which means that suppresses our immune level, we need an antibiotic to cope up with that. Doxycycline dosage depends upon the methylprednisolone dosage. You can start with 100 mg 2 times a day for minimum 5 and maximum 10 days. While using nebulizer, make sure the patient is isolated in proper ventilated room towards outside. Also, the caretaker has to wear protective face mask and face shield. This is because nebulizer machine produces COVID aerosols. If you can't afford to buy a nebulizer, you can still go for inhalers. Inhalers are the safest as they do not produce COVID aerosol, and most doctors recommend inhalers. If you are a diabetic patient, then methylprednisolone, Budocort, and Duolin may spike your blood sugar level. Do not panic. If your sugar level is below 250, you can continue your regular diabetic medicine. If your sugar level is more than 250, you can add teneligliptin 20 mg and metformin 500 mg to your regular diabetic medicine. And if it's more than 350, you may need 5 units of Actrapid. And if it's more than 400, please consult your doctor. Monitor temperature, SpO2, blood sugar level, and blood pressure rate for 3 to 4 times a day. And to know the patient's recovery ratio, you can have a CRP test done once in 2 days. And the test result should always result less than 25. Like I said before, timely oxygen can save lives. This trick helps to maintain the oxygen level above 93 and helps buy time. Opt for this trick and help your family members suffering shortness of breath. Share if you care.